es en inglés, así que los que no tengan traductor les recomiendo que traigan un traductor. Está a cargo de la doctora Jennifer Canstein del Johns Hopkins Medicine. La doctora Canstein es directora de Psicología, Neuropsicología y Trabajo Social y codirectora del Centro de Salud Conductual del Johns Hopkins All Children's Hospital y tiene un fellowship en Psicología Pediátrica del Baylor College of Medicine. La doctora Canstein fue honrada por excelencia en el servicio y profesionalismo en Johns Hopkins All Children's Hospital en los premios clínicos de medicina de Johns Hopkins para 2020. Después de graduarse de la Universidad de Indiana, Purdue, de la Universidad de Indianápolis, completó una pasantía pediátrica y una beca en el Texas Children's Hospital. Y la doctora Canstein está certificada por la Junta en Neuropsicología Pediátrica y Neurología Clínica y nos va a dar esta excelente charla sobre Burnout. Bienvenida, doctora.
Thank you so much for having me here today. It is truly an honor to be with you for this fantastic conference. One of the very important topics that has emerged from us since the pandemic is the topic of burnout. And as a provider and as an individual who continues to work with multiple providers for their own well-being and mental health, it's incredibly important for us across all areas of healthcare to understand and also be able to support our individuals who have concerns not only with burnout and exhaustion from their work, but also other concerns that arise from everything that we do every day. My goals for you all today are to understand and identify signs and symptoms of burnout, outline ways that each of you individually can impact your organization's well-being, and in addition to that, because it's most important for us to take care of ourselves first, also recognize 3 opportunities that you have to be able to improve your own well-being. And that in general will also help the well-being of your organization. When we talk about stress and burnout, what we see are a number of components that lead to that heightened stress, anxiety, even distress, stress that we feel when we're put in situations that can really impact or push against our value system. This may be a life threat, a traumatic event, such as our coming out of the COVID-19 pandemic, during which time during the pandemic we saw many of our patients significantly impacted, maybe some of our family members as well, experiencing significant health issues as well as the potential for death. With that in mind, as providers in the hospital setting every day, we also see great loss and that continual grief injury, whether that be through moral distress, being put in situations each day in which your own value system is being tested against potentially the regulations or the rules of the organization in which you are working, or being asked to do something that would be against what you might think is the best medical advice because we're putting the patient first or doing that patient-centered care. So a lot of times our providers and those who are the closest to the patients are constantly in a state of moral distress and experiencing that grief injury over and over again. This results in the inner conflict, the conflict that we feel when we're witnessing behaviors that violate our own moral values. And like I said, it's that wear and tear over time, the accumulation of stress from all sources that continue to build upon us if we aren't taking sufficient time for rest, recovery, and support. And really, that's one of the most important pieces for all of us to understand and be able to support in our organizations, because we need to have the healthiest caregivers in our hospitals and settings in order to be able to provide the best care to our patients. How we recover from stress is incredibly important. Those impacts include how we cope, what that recovery looks like, if we've developed any unhealthy coping strategies along the way, because burnout is the accumulation of all of that. 2 of the most important things you can do to be able to support yourself and others through burnout, you'll hear me say this numerous times during this talk, are sleep and social support. So having high quality, sufficient amounts of rest and sleep, as well as the social support of your peers, are highly protective against symptoms and resulting burnout. In addition to that burnout, we sometimes see ourselves and our colleagues progress to an even higher level of mental distress, which results in things like depression, anxiety, post-traumatic stress disorder, or even substance abuse. And despite our stress from the COVID-19 pandemic falling, we continue to see that stress is popping up for our team members in other areas. And those stressors continue to build upon themselves, creating that moral distress situation and that increasing symptoms of burnout. So what we know is that before the pandemic, about 40% of our healthcare workforce in the United States was burned out. And current rates suggest that those numbers are as high as 50 to 70% across medical specialties. Our team members were already burned out before. These factors that predict burnout include clinicians' age, their gender, religiosity, and the ethical climate of the organization. If you reside in an organization with a more negative climate, without having potentially a just culture, where we recognize human error, we support our team members in re-education rather than immediately disciplining, then those things lead to higher levels of burnout. Interestingly, during the pandemic, number of COVID-19 patients served, number of night shifts worked, and time since your last vacation does not predict burnout symptoms. Rather, heavy workloads, significant administrative burden, especially related to notes, placing orders, phone calls, follow-ups, having a lack of control in your day-to-day work, and overall inadequate well-being and focus on well-being of your organization predicts those symptoms overall. In addition, satisfaction with income does not impact burnout, despite many of us often feeling that just having that pressure off of having an increase in salary or being able to make more money. And what you see in the data and in the research, that doesn't decrease our overall burnout over time, because it's about changing the nature of the work that we do and how we manage that day to day. In addition, we see higher burnout in individuals who did not choose their profession willingly. So if you are not in a profession that you chose, maybe you ended up there because it wasn't the path that you wanted to take, but it was what you needed to take in the situation, or potentially some other extraneous factors impacting you, and you're more likely to be burnt out as well. We see lower burnout in those individuals who are more enthusiastic or excited about their profession. And having a medium level of emotional exhaustion is protective. If there are high levels of emotional exhaustion or really low levels of emotional exhaustion where maybe can you imagine feeling bored or not as engaged in your daily work because there isn't as much going on? Those two ends of the spectrum lead to more burnout. There is that medium amount in the middle that is just right. In addition, low levels of depersonalization are protective. If you are not feeling that you are engaged in your work, if you're feeling like nothing you do can help, if you're feeling like you've removed yourself from the situation and kind of given up your power and your control to the administration above you, those are going to be topics of conversation when we're having conversations about burnout, because those are signs and symptoms that we see in this area. Interestingly, if you're a parent who continues to work, you are likely continuing to exhibit and experience difficulties with childcare. And we see this as one of our other primary contributors to how well we manage our symptoms of burnout. If you're worried about childcare, if you're worried about your child from day to day, and the coverage that you have while you're at work for your kid, for maybe multiple children, then we are likely to see more burnout as well. And during the pandemic, for moms who were still working, worrying about everything at home, and worried about their children, we saw a significant increase in the amount of alcohol consumption that they were experiencing, with many of our mothers who are in the workforce, specifically in healthcare, tripling the amount of alcohol that they consumed during the first year of the pandemic. Interestingly, for any parent who was continuing to work in the healthcare field during the pandemic, On average, they gained 26 pounds. So what you'll also see is that as I'm talking about mental health and talking about burnout, all of those impacts also impact our overall physical health. So significant use of drugs, of alcohol, lack of sleep, as well as weight gain impact our overall physical health and well-being as well. As you're thinking about symptoms of burnout, potentially in yourself and your team members, I want you thinking about some of these listed here. The ones in bold are the 3 most predictive of burnout symptoms. Cynicism, feeling that you can't change anything around you. Depersonalization, distancing yourself from the job, feeling that you don't have any control. That emotional exhaustion. You maybe start the week out feeling refreshed after a weekend, but by the end of the Monday workday, you're already feeling exhausted and dreading the rest of the week. Having a low sense of personal achievement, being irritable or easily set off, having difficulties with sleep and maintaining sleep, having more of a depressive reaction to stress, feeling down, sad, dark, and negative, or potentially being more aggressive, feeling yourself getting worked up. This is, for me personally, where I've been in the past couple months is just feeling really frustrated, feeling upset with what's happening at times, and recognizing that that's because, for me, my values have been in conflict with what maybe is happening around me, and then I'm not feeling that I can make the change. And so when you start to recognize those symptoms for yourself, incredibly important for you to be thinking about what are your coping strategies, because at that point, either you, maybe one of your team members, is heading towards those signs, symptoms, and potential outcome of burnout. We see increased errors when burnout is high, and increased employee turnover as well. For our physicians, we know that work overload, lack of control over their work, having unrealistic expectations of their day-to-day, and again, that lack of social support, a lack of support from their colleagues, from their supervisors, regarding that the needs that they have every day can be met and that they can do their job as well as they want to. Financial stress and our personal problems outside of our day-to-day work life also impact our overall burnout and resulting well-being. So as I mentioned before in health professionals, sometimes when that burnout has reached a level that we have not utilized our strong coping skills, we see an increase in alcohol abuse, depression, and even suicide. In the United States, before the pandemic, we lost 400 physicians per year to suicide. And I'm waiting to see those results come out for during the pandemic as well. When burnout is high, we see increased errors, increased turnover, reduced patient satisfaction, reduced quality of life, and higher malpractice claims. So truly, when burnout is high in your organization, the economic impact is high as well. And with drastically increasing stressors inside and outside of work, without adequate approaches for how to combat these stressors, we'll see an increase in burnout. Now, Headspace did a fantastic global survey of employees in the healthcare field and their thoughts surrounding what their leaders and their organizations were doing for overall well-being and burnout. 81% of global employees believe that their employer has a responsibility to improve and help them manage their own mental health. So it isn't about what you're doing outside of work anymore. Our employees, 4 out of 5 of them, believe that what we do in the workplace as leaders, as administrators, as team members, is a responsibility to improve their overall mental health and well-being to reduce burnout. So increasingly important for our leaders to be recognizing this. Now, we know from this same survey that employers have been pulling back on their mental health programs, especially as we've come from COVID pandemic to COVID endemic, when our employees need and want it the most. So 71% of our global workforce says that their employer did increase the focus on mental health during the pandemic, but only 25% say that their companies kept that focus. And while 80% of those CEOs of those companies say, of course we've kept that focus on mental health, only half of them have kept it on the other side of the pandemic. And even though, again, 88% of our CEOs say they offer mental health benefits for their employees, Only 61% of those employees know about those benefits and are willing to say the same. So we're having a discrepancy between what our leaders feel is happening and what our employees are feeling on the ground. So again, incredibly important for each of us in this room, as team members, as colleagues, as leaders, to be focused on creating a resilient organization and being able to support our teams. What you have here is the 6 essential elements for overall healthcare worker well-being. What you see is having that organizational commitment to well-being, a strengthening of leadership skills and behaviors, an understanding of the workplace, doing a workplace assessment so that you can determine what your workplace needs and what you can do to best support your team members. We need to examine policies and practices, especially as it relates to those administrative tasks that I mentioned that can be more time-intensive and burdensome for our providers and our team members. Enhance workplace efficiency, again, thinking about the policies and procedures, how to best utilize the skills of each individual on your team. And then cultivating a culture of connection and support. Again, that social support between our team members is incredibly protective against symptoms of burnout. So create those opportunities. How can you within your organization promote opportunities for social support? Can you offer programming and support for professional development? Is it possible to think about some flexible work arrangements? In the hospital setting, this can be incredibly challenging, especially given that our work happens in person with our patients. So are there opportunities for some telemedicine, but in the inpatient unit, can we do some flex hours? One of the children's hospitals in the United States has moved for their nurses to a 9-month per year work year. So for the United States, the nurses choose which 9 months they want to work. And if they have children who are in school, many of them are choosing to work those 9 months of the school year and then have the other 3 months available. And other individuals pick up those 3 months and flex so that they can have a very flexible work schedule to be able to best support their families and their needs. Do you have well-being programs that could be made available to your team members? Even if it's an app that can be on their phone supporting meditation, well-being, daily affirmations, or journaling. Can you provide support for automatized work? How can we streamline documentation? How can we reduce that overall administrative burden? And there are numerous ways to be able to do this and remain compliant as well. And one of the most important pieces, especially for each of our team members, is allowing that time for leave, whether that be a vacation or sick time, birth of a child, without repercussions. How many of us have left to go away for vacation, maybe tried our best not to check our emails while we were gone, and came back to 1,000 emails? And so it doesn't even matter how long that you were away, because now you've come back to all these emails, and the stress, the emotional exhaustion has returned to the same level it was before vacation. And why even go at that point, right? It would have been easier just to stay and not have to get caught up after that time that you were away. So when we think about this, there's numerous programs that can be incredibly helpful. Stress management programs, such as mindfulness-based stress reduction, can be incredibly helpful for your teams. Access to physical and mental health resources. That means not only adding potentially a gym or some type of physical activity opportunity for your team, but also access to mental health resources so that they can have that time potentially to decompress with other team members and colleagues, or a therapist or psychologist if needed. Encourage the things that you all already know and that you talk to your patients about every day. Exercise, healthy diet, and sleep. And while we all know these things and we talk to our patients about them all the time, how many of us are actually scheduling those into our day-to-day? How often are you getting 8 hours a night of sleep per night? How often are you making sure that you're having a healthy diet, that you're limiting alcohol consumption, limiting sugar, and being able to get a sufficient amount of water in your day-to-day? Those are the things that we're asking our patients to do, and incredibly important things for each of us to be doing as well. Whenever possible, offering tuition reimbursement programs, opportunities for our team members to get other certifications or enhance their education to be able to best support them in the future. And again, offering that time off without repercussions, whether it's a vacation or a strategy where you can put into place an opportunity to attend a conference, go to a workshop, encouraging that learning without it being a burden on the rest of the team members. Because when we have that time away, sometimes our team becomes resentful if someone else has attended a conference, been at a learning opportunity where the work was more, that burden is more when they were away. So whenever possible, being able to support our team members in that as well. And then think quite a bit about your culture. Remember, a culture that doesn't have support, that really functions on discipline, on reaction, on not focusing on human error as something that we can accept, that we can work to be safer for all without punishing, especially when something happens that was, of course, not meant to be. Our team members never mean to be doing things that are harmful to our patients. Create that culture of respect and collegiality. Provide opportunities for feedback and communication. Be responsive to concerns that are presented to you. Listen to hear what your team members are saying rather than listening to respond to what they've said. Because sometimes when we're listening to respond, we're holding that response in our minds rather than fully listening to what they're sharing to us. Make the joy of medicine, everyday well-being, and gratitude a part of our everyday work. And I'm going to challenge you with a request in just a minute as well. And maintain open discussions surrounding moral distress and ethical challenges. The more that we can be open and support our team members, the better they are going to be able to process those day-to-day situations in which they have had moral distress, where they've experienced maybe the death or morbidity of a patient, and being able to process that, giving our team members time to step away after a stressful patient situation will help decrease that overall burnout and also decrease the economic burden on your organization as well. What we have here are the 5 C's, especially after a crisis situation. These are a great opportunity to maintain a conversation with your team that covers these 5 areas. Cover, so how did that situation affect your sense of safety? Calm, what changes have occurred regarding your ability to keep calm, to be able to sleep, to maintain yourself? Connect, has there been an impact on how you connect with others? Are you getting that social support that you need? Competence, do you have any concerns about being able to handle a situation or our organization's ability to handle a situation? And then confidence, has your confidence changed in yourself, in your leadership, and your equipment? And taking what you hear from these 5 C's and bringing it back to think about how you can best support your team members will again be another opportunity for your organization to reduce burnout overall. Debrief unit by unit, as a profession by profession when these situations happen. Catalog what you've learned, and then really think about your workforce and your organization-wide support for how you'll be able to work through recovery and restoration. You can maybe do a dedication or memorialize the sacrifice of your team, potentially with a mural, with a shared activity where everyone can work together, and then resume those efforts that you've been working on and through programming to be able to maintain that workforce. But throughout all of this, it's incredibly important for each of us to be taking care of ourselves as well, because in order to best model this for our team members, to make sure that we are leading with a culture of well-being and support, we need to be modeling these things as well. Recognize your own limits. Prioritize and delegate as needed. Engage in the coping strategies that you also talk with your patients about all the time. Deep breathing, mindfulness, meditation, or yoga. You can have a daily reminder on your phone. Every day at noon, my phone goes off with a reminder to remind me to hold true to what my values are, the values that I want to bring to my team and to my organization every day. And sometimes on the days that have been most stressful or most challenging with a patient or with a team member, it's when I need to see that reminder the most. We're going to talk about a cognitive behavioral strategy to use, but whenever possible, ensure that you are maintaining choice in your day, the specialty that you engage in, the additional work that you add to your plate, and resilience training as well. So I want to challenge all of you to start your meetings with your team a different way. I want you to take 2, 3 minutes, maybe even 5 minutes at the beginning or end of every meeting that you have and challenge yourself and your team to do one of the following. Email someone who made your day better. Write out 5 things that you're grateful for. Or ask even for someone to shout out. Who's a team member that really helped you today? Who's someone who did something great? Maybe they had a great patient experience or a good catch. What might work for your team? Pick one of these. If it's a weekly meeting, if it's a monthly meeting, try to start with that bit of joy and gratitude, because we know that 6 weeks of joy and gratitude with a joy or gratitude every single day, will change your mindset and improve symptoms of burnout as well. That can include something very personal, such as a gratitude journal. You can make that part of your daily practice, notating your gratitude list in a place that you see every day, and there's great apps for this as well. For me personally, I keep a Post-it note on my desk for the things that I'm grateful for each week, so it's stuck up on one of my monitors, and I can see it every time I'm on my computer. You can do the same thing in your home, maybe on the bathroom mirror, someplace that you are every single day, and you can see the 5 things that you're grateful for. We also have our hands, and so we can use them to count in the morning as we wake up. The things that we're grateful for might be our own health, the health of our family, our jobs, anything that we have around us. And whenever possible, thanking others. As a child psychologist, one of the most important things that I tell parents is that it's 3 to 1. 3 praises for every 1 negative or corrective feedback. And that's no different for any of the individuals that we have relationships with every day. You want to be able to give 3 praises for every 1 time you have to give a negative or corrective feedback. I promised you a cognitive behavioral skill, and we're going to work on some cognitive restructuring really briefly here. So what this is recognizing when you have an automatic thought. When a thought pops into your mind, it's brief, but it happens automatically. It often can be maladaptive, meaning that it's overly negative. It might be black and white thinking. It might be a thought based upon previous experiences that doesn't allow you to step and see rationally the situation ahead of you. We want to be able to challenge these automatic thoughts. So here's an example. You have a situation. A colleague walks past you in the hospital and seemingly ignores you. They don't say anything, they just walk right past. Your first thought may be, oh, they ignored me. They must be mad at me. They must be bothered by something that I did. You may feel sad, anxious, or rejected. And your first thought might be, well, I didn't get to that meeting on time. I didn't turn in that note on time. I was late one day last week. But also, there's plenty of evidence that doesn't support them being mad at you. They typically acknowledge me. They might be busy today. They didn't look up. For me, sometimes it's I'm in my phone, texting or emailing and not looking where I'm going, so I don't even see people who walk past me. So your automatic thought was, they must be mad at me, which immediately does not feel positive. It feels bad. And we have to stop that thought and challenge it. There's plenty of reasons why they're not mad at me. They just happened to walk by. They were in a rush and they didn't see me. If you can challenge one of those automatic thoughts every day that's negative and makes you feel bad, then you're going to be able to have significantly more positive interactions. Record those situations, thoughts, and feelings. Pick that one thought every day. What can I do about this? Because no one talks to you every day more than you talk to yourself. That voice inside your head is constantly going, whether we're listening to it or not. So making sure that you're treating yourself as you would tell a friend that you would want to treat them as well, and craft that alternative thoughts. So in conclusion, we can't control everything, but changing the language that we use with ourselves, changing the language we use with our team members, can help change the culture of our entire organization, and we can model that very effectively. Our team member burnout in the healthcare field is a very serious problem that can have negative effects on the entire healthcare system, not only on our own mental health and physical well-being, but also has a significant economic burden on our organizations as well. And there's a number of things that you all can be doing in the workplace, both for your team members and yourselves, to best be able to support overall wellness and well-being of your team members. I have some great references for you here. I want to point you to Craig and Snook from Harvard Business Review in 2014. We didn't have time for it today, but a great opportunity to make your own vision statement for yourself, one that you can really hold true, a mission that you want to be able to carry forth in the work that you do every day. Thank you all again for having us here. It was a pleasure to be with you. And if there's time, I think we may be able to answer a question or no questions. Oh, my apologies.
No tenemos el tiempo para preguntas, sé que había alguna por ahí, pero los invito a que aprovechen a Jennifer en los pasillos para hablar con ella. Fue un placer, de verdad, muchas gracias por habernos acompañado en esta primera tanda. Los invito a que tomen el break del café y que en media hora estemos nuevamente aquí para continuar con las experiencias exitosas en atención centrada en la